next guest. Maggi Savo is a Healthcare and Improvement Analytics Director at Baylor Scott & White. Maggi, please do join us. She is working to mature data and analytics for performance and innovation at Baylor Scott & White Health. Maggi Savo is a Healthcare Improvement Director focusing on analytical maturity to achieve continued success in value-based care and shared savings. She will share with us methods and tips to develop demand for integrating data into strategy. And I have to say, I was just talking to Maggie beforehand, we have here this global audience with Africa, Asia, Europe, United States, and I just learned that Maggie is just down the street from where I live in San Antonio. So coming from Austin, Texas to the world, thank you so much, Maggie, for sharing your expertise and journey with us today.
Oh, thank you for having me. I'm so excited. All right. Baylor Scott & White Health is one of the largest non-for-profit systems in Texas and one of the largest in the United States. We have over 50 hospitals, 7,500 physicians, more than 7 million patient encounters a year. Baylor Scott & White Quality Alliance is the affiliated ACO for the organization. We're a subset of providers and overall physician population. And we have partners in key markets that you see highlighted on the screen there to address patient need. We also work together as one large integrated network we are at risk for all of our member lives. And we have been extremely successful. We continue to have success as one of the top 10 ACOs in shared savings for 2 years in a row now with CMS. So we are aggressive in what we do and quite successful. So today, my goal is to share with you methods that the QA uses that have contributed to our data-driven approach, how we've really developed trusted partnerships between analytics and our leaders, and we'll review the importance of asking questions, how to translate those requests into actionable insights, and then how we've been able to get analytics included in discussions earlier, and how we manage capacity and prioritization to stay efficient. Communication. Executives, clinicians, analysts, they all speak different languages. Some of the words may overlap, but they're all stated, interpreted, and delivered differently. Get comfortable and help your team get comfortable with asking what else. Eventually, a root cause will be identified. Second, keep asking questions until your description of the ask meets that of the requester. Find phrases that incorporate translation and repetition of the ask. The dialogue that occurs when a request is translated back to the requester will develop a more comprehensive set of needs. It's a really critical part. Here's a couple of examples on the screen that we use with our folks that have really worked well for us. Then find a process that works to share both soft skills and technical tips. As analysts learn and collect facts, find a place to store those and support knowledge share. For example, patient demographics are most similar at facility A, B, and 1, 2, 3. Or technical tips like flags, stored procedures. Keep those items in an easily accessible location and include them in your onboarding exercises, your processes, your standard workflow. The quicker your new hires can get up to speed, the quicker their analysis becomes value add. And that's what everybody really wants. The ability to ask and answer questions is critical to learning. going back to Socrates and his method to draw out beliefs about a topic. So how do you teach your team how to ask strategic questions? Help them define a good question. All questions should have a purpose, but be really careful you don't disguise an opinion as a question. Avoid, don't you think it should, or have you considered? Keep questions clear. Keep them simple. Keep them brief. Keep them thought-provoking. Avoid yes-no answers. Define, clarify, and focus discussion. And finally, always ask what else. This is a great technique actually picked up from a physician training course on communication. Give this a try in your real life. Finishing your grocery list, ask your family, what else? Wrapping up your one-on-one with your manager, ask them, what else? So here's a real example. We received a request to create a Power BI that shows what % of our facility volume is a BSWQA member. So for a system with 50 hospitals, 160 plus outpatient clinics, we thought this would be a great exercise for a new hire. Nothing like throwing them to the fire. Meeting 1. Questions went something like this. What facilities do I include? Oh, all of our hospitals and clinics. What type of visits? Inpatient, ED, and outpatient. Throw in some obs. Okay, so the new hire was like, great, that makes sense to me. Meeting 2, this is what she looked like. She had realized that we actually have 2 EHRs, and finding one data set that could be the source of truth was nearly impossible. So as we discussed visit types, data available, we kept asking the analyst, what else? In response, her questions became clearer, simpler, which helped shape her approach. When we finally got to the point that visit types were going to be identified differently across the data sources being used, the facilities being included, she began to think about commonalities, how data could be grouped, and find a way to present very complex data in a simple to understand visual. So going back to the need for a process to share skills and tips, we use analyst recaps. These are provided in our huddle or performed in our huddles, and analysts recap the work they completed last week. We ask them to answer 2 questions. What did you learn that can be applied in your future work? What got you? Did you learn that you can avoid in the future? In our huddles, that first question, what did you learn, is usually soft. XY leader, they think of facilities as brick and mortar. Where question 2 is usually more technical. Don't use patient class type to identify visit type when you're working across multiple databases. And so we always end that ability to go back and end the discussion with a summary, translate the word into your own needs, you understand it better, and you develop a better product. Good stories depend on what you're looking for. We don't all like romance novels. We don't all like action novels. Numbers, tables, data, they scare even our best leaders. The challenge we see on a daily basis is enabling our analysts to tell a story using words their audience can relate to. In digestible chunks, that the audience can feel confident retelling and sharing. Truth is, our analysts are socially awkward and introverted. So finding a way that they can connect with the leader and get that leader hooked on the data story, all while empowering these socially awkward, amazingly intelligent team, is critical to success. So the steps on this slide are an ever-evolving process that is continually challenged and improved upon. Our 4-step process aligns nicely with Plan, Do, Check, Act. Plan. A good plan establishes a problem. It identifies objectives, creates testable hypotheses. Use your summary of the ask, repeating the ask in your own words, to define the problem and create context. In the beginning of my presentation, I said we asked our analysts to end a discussion by summarizing the ask as they understand it. That keeps analysts aligned to our business partners. It also keeps your business partners or your audience engaged in the data story you're going to tell. Develop your characters. We speak to employers, payers, in terms that the audience understands. If you're going to speak to finance guys, speak finance. If you're going to talk to physicians and nurses, make sure your content and your story is clinical in nature. Then set expectations. Identify data limitations and be clear in what can or cannot be delivered. Do. Create simple visuals, such as histograms, stacked bar charts, line plots. Those are all more easily understood, and use them to craft your narrative. Excuse me. Sorry. And then craft your narrative, keep your audience focused. While fancy visuals feel cool, your users don't have time to figure out the conclusions that you wanted them to take away. Tell them. Tell them what you told them. Check. Identify insights that are available from the visualization. How many patients needed to be adherent to hit target? What patients are most likely to engage? How many patients haven't had a PCP visit this year? Help the team define success by identifying insights that are meaningful to the team taking action. Don't give nurses insights related to cost savings. You can't do anything with them. Keep the insights relevant to the team doing work and help them correctly identify, interpret the data, interpret the visual, and align what they're trying to do with the results and the goals to make sure everyone is on the same path for success. Act. Recommend actions based on insights that are specific to your character. So keeping that thread of a story moving along. Explain what the visual shows, how it can be used in developing improvement initiatives. We're getting a bit iterative in our process, but that goes back to tell them what you told them. The most advanced analytical maturity models and capabilities leverage analytics to influence strategy and support transformational improvement. Care management is our largest headcount in the QA. We spend a lot of time integrating their patient outreach with quality improvement initiatives. For example, we use predictive modeling to identify members most likely to engage with care management, and then prioritize those members to schedule discharge visits, follow-up visits, gap closure. Breaking down the results into bite-sized chunks, helping our users find where they get those chunks, helping them connect those data insights to the improvement work they're doing, and building their confidence that they can speak to your visual has led to a very successful integration. And that's part of why we keep iterating on this plan. It just like the analysis that we perform. Start simple. Ensure your users are successful. They'll come back asking more complex questions. Then build to that foundation. Leverage your foundation and your user engagement to progress towards more predictive insights. But keep those both closely aligned to strategy and continually improving. The Quality Alliance began our analytic journey very descriptive in nature. We overmeasured 50+ quality and utilization measures. Please don't ever do this. It is way too many. We provided a ton of results describing what happened, but we didn't identify why, and we didn't connect the opportunities to a business strategy. Analysts were invited to meetings, but they weren't in the driver's seat. As we've matured, analytics started being used by our executives and business partners to make decisions. Expectations increased. Analysts needed to be owners, partners, and drive the use of their data. At the same time, our business focused on a narrowed set of actionable measures that connected to our strategy. We went from 50+ to a manageable handful. Our analytics improved their understanding of how measures were being actioned to the business pillar or partner that they were aligned to. Quality and utilization, great examples. This allowed them to leverage their understanding to evaluate correlations between outreach and performance. They presented these correlations to leaders and partnered with them to develop improvement initiatives. Our analysts also took ownership of meetings. We increased the frequency of those meetings. Many of them are weekly. Our analysts drove agendas. They focused on education around the tools available. Each analyst presented at least monthly to their business partners, providing insights, correlating outcomes and initiatives together, identifying actionable populations. Our analysts started developing skills beyond that of analytics. They were becoming subject matter experts for their business partners. They not only understand the intimate details in the data, but they're able to explain how those details are correlated to improvement. They developed their characters. They kept the content relevant. And then we increased transparency of the work analytics is completing. We prioritize work weekly. Our analysts are fully transparent in the work they completed last week, the work they have on chart this week, and the order in which they're going to complete that work. Our business partners have full authority to change prioritization to keep analytics aligned with changing strategies and initiatives. Change happens daily. Analytics needs to be part of that change so that our team always feels that we're right there. We're a core part of what we're doing. Currently, we've started integrating machine learning to gain efficiencies, develop clinical programs, and drive improvement. Since July, so just a couple of months since July, we have released 3 predictive models. a high need, high cost risk stratification, pediatric patients at risk for hospitalization, and a risk stratification using a wellness questionnaire. These models are each being used to support strategic initiatives, mostly for our care management and our clinical excellence teams. 3 models, 2.5 months. Yes, we started working on the models before July, but because we use weekly prioritization, we were able to keep pushing lower busy work requests to the bottom and keep these model developments, keep leveraging machine learning that aligned with our big strategic initiatives for the year. So for care management, we are combining a member's risk level, their likelihood to engage, and our utilization data to develop a staffing model for practice outreach, transitions of care, and alignment of members to appropriate resources. We are putting patients with more social determinants with our social workers. We're putting people with more complex diseases aligned to our RNs. For our clinical excellence, we're also leveraging those same determinants and real-time cluster analysis to identify correlated data elements to population cohorts so that they can design programs more efficiently. How many patients overlap with major complex diseases and multiple chronic diseases? What's that overlap look like? Do they need separate clinical programs? That's how we're leveraging machine learning today. Our transformation has been successful because we've developed our analysts into subject matter experts, integrating them into the teams they support. This has progressed our culture from descriptive to predictive and actionable analytics. Our care management team, prior to COVID, of course, had a workstation for analytics on their floor. They wanted one of my socially awkward, super intelligent people there every day to help them understand, to help them connect the pieces. Our clinical excellence team includes analytics in their team meetings. We are truly integrated with our business. This has also created shared expertise within our analytics team because we do those teach backs. We put all those lessons learned, those gotchas, those technical tips. We integrate those into our wiki where people can go find them and use them. And then second, we continue to focus on data literacy and teaching our business partners and leaders how to use visualizations. This supports and allows us to advance complexity of insights that are integrated into improvement and development work much quicker than we used to. When technical folks think of throughput, it's around data transfer, bits per second. What I really want you to think about is capacity, prioritization, and effectiveness. Use some type of time tracking. There are tons of free apps out there. There's some cheap pay-for-service ones. Big systems have time tracking. Use something. Start with simple, large, poorly defined buckets where your team can track hours. As you begin to evaluate how many hours are spent on meetings, you're going to cry. Then you're going to find a way to eliminate waste. But you're also going to determine what business partners or pillars or service lines or requests are consuming the most hours. You'll begin to track different fields, requesters, databases used. This will help you put an objective number to the hours until your team cries uncle. What's that point where you have too much work, people are spread too thin, and you're going to start sacrificing quality just to get work done. Time tracking helps you identify that. Use that to support a request for more FTEs, to scope future work, to plan what's coming down your pipeline. Our team functions right around 90%, which took years before my leadership to get to. And that number is really high compared to other teams. So don't be shocked when you start this and you realize what capacity or how much work you're doing compared to how long it takes you to keep the lights on. For prioritization to be successful, all requests should have a business sponsor. The higher, the better. Ideally, someone at least at the VP level or above with visibility to broader scope, system strategies, business line strategies. This will help keep your work relevant and aligned. We've all had work with too many cooks in the kitchen, so keep your prioritization team as small as possible. This will help you get a decision and have accountability. Review and prioritize your asks at least on a monthly basis. This ensures that any new work added continues to align with other initiatives and strategies. This visual over on the right is how we prioritize one of our team's hours. Doing quick math, that adds up to 100. As I mentioned, this team functions at 90%. So my recommendation would actually be to change the hours to 85 to 90 of total hours available. Using this structure, there's a balance between building clean data infrastructure, providing insights, customer service, and the operational work to keep the lights on. It's a really important bucket as well. This team requests new work about quarterly, and we'll prioritize work or hours right around 1 or 2 quarters worth of work at a time. And absolutely, there have been times when an urgent request will need to be addressed. So we stop, ask our leaders to reprioritize. We want to make sure our teams are always working in alignment with our leaders and system strategies. We use people surveys, we use engaged surveys in our system. That alignment that your team's work feels connected to system initiatives and system strategies is a huge driver. We score really well on engagement because people understand the process and their contributions on a daily basis to moving strategy. So the visual on the last slide showed the buckets that we use to think about time and work. Find a method and a structure that works for you, where you can identify daily, monthly, or quarterly items that remain constant. When our analysts have been supporting a request without change for multiple data refreshes or multiple months or quarters in a row, we look for a way to productionalize that into a product. It's transitioned from our analysts to our reporting team, which frees up an analytic resource, standardizes the product, and helps improve our infrastructure. We're all dependent on each other and very interrelated across our analytic roles, just as we are with our business partners. We keep our ETL or our data warehouse team away from our business partners. They get to work on data quality, on infrastructure, ingesting our payer files, and integrating with our EHR. They don't need to ask the questions to our leaders. They need to have a clean request, define deliverables, and help our team be successful. Always try to use prioritization and transparency to your advantage. And then Identify that iterative or phased work as early as possible. It's those projects that come across your desk where you're like, oh, this is going to be big. Create that high-level scope. Create the context, set expectations around it, and then identify and know what additional requests you anticipate coming, what additional questions you're going to develop, and then as they do, move that to a parking lot for a later phase. And don't just forget about it. Be transparent with that parking lot. Let folks know what work you have waiting. This will always keep your work focused, allow for new development of future phases, and align to strategies. Identifying additional requests is also important as we transition our work from an analyst to a SSRS or a report writer. That transition becomes more successful so that the report writer isn't blindsided with, well, what about this? And I thought we discussed that. They know where to find that parking lot. They know where we store additional requests. And then finally, start in the shallow end. Don't dive headfirst. Prioritization, transforming data uses, it's hard. So hopefully you've found some key takeaways around how to empower your analysts, how to create good data stories, how to integrate data literacy and education of your stakeholders into an iterative cycle to keep work churning along, to keep your work and your analytics progressing and aligning with strategy so that your leaders feel as empowered as our leaders do to give analytics a seat at the table, to treat them like a quality team member, a care management team member. Those are really critical to helping your data transformation at a system. That is my contact information, so I am more than happy to always field questions.
Maggie, thank you so much for that. We have questions that have come up during your presentation, and I'll relay those to you. So the very first one is that if you can back up a little bit and just kind of give us a little bit of the overview of the journey in terms of a timeline of where you started, in the healthcare organization, where, what has the journey been like for you and for your team, where you started, how you started, and then how things have evolved in the last few years?
Yeah, so the Quality Alliance, the ACO arm, is a relatively new business unit in terms of our health system. So we've been around for about 5 or 6 years, and we really started descriptive in nature. I mean, we were reporting performance rate after performance rate, but we weren't connecting it to anything. So it's lagged data. And the trend in healthcare are leading measures. And how do you know things quicker? How are you able to predict impact? And so we hired the most incredible folks that we can, and we invest in them, we empower them. And so over the last maybe 2 years, really, we've made that transition to predictive and action-based analytics. And really that's been through that partnership of developing strong folks, teaching our leaders, building confidence as a team.
Very well. And on that, so for someone who may be starting that journey today, what would be some advice you give to them on how to start on the right foot?
Take off a manageable chunk. Be careful with how much you think you can do and how much you agree to do. Find a nice balance between building that platform or that foundation for your analytics to be successful. Choose measures that you can build, choose easy to identify, easy to understand improvement initiatives, and allow your partnerships to really be successful because you connect a result to the performance improvement opportunity, and you're sharing education, you're empowering both your partner and your analyst to be successful together. And then that education and that need to progress will be a very naturally occurring event.
Very good, good advice. What we have seen here through the commentary and the questions is also this theme on related to your team and or your core and extended team. So if you could talk a little bit about what that team looks like, how many people are in that team, and really most important, what skill sets do you have on that team that you think is maybe the ideal mix to have in a team like that?
Sure. So I'll start down at our ETL or our data warehouse team. We have 5 of those folks. They are phenomenal. There is nobody in our system that knows how to process a Blue Cross Blue Shield payer file into usable data like they do. Then the next kind of level of our team is our report builders. Those folks that take a productionalized product, something that hasn't had changes or needed to be changed over a period of time, and they create standard reports. Part of what else they do that puts them beyond just a report builder is they identify and they track what reports are being clicked most often, what filters are being used most often, and so they can take and improve a Power BI or a Tableau product that one of our analysts has developed, and they integrate the functionality between the two. So now we're able to connect multiple insights across products. We can do it for our quality folks, our post-acute care, and our network. We're integrating all of those into one big, easy to use, very simple visual. So that team has 4. We're fairly lean in who we employ and how big we do and what we're able to achieve. Our largest group are our analysts. We use the word analyst probably a little bit inappropriately, to be honest, because my folks are just that smart. They are more data scientists. I've got applied mathematics, I've got statistics, I've got engineering degrees, I've got clinical degrees, across the board. So not one size fits all. It's really, do you have the right personality to bring to the table with the desire, I think is a good word, and expertise. So we have 4 or 5 folks that work on our finance, and then we have 5 folks that work on all things care management, clinical network, post-acute care. And, so we're about like 22 on our team.
Very good, very good. It comes across as a more technical group, of course, and I'm curious on how do you connect that the members of your team and the work that you do with the business itself, the business leaders, the different business areas, and specifically not just on the report and the analytics and the reporting, but does your team get involved in the execution of improvements and innovations and changes in the business that as a result of those reports and analytics?
Yeah, so that's super cool. In the last year, we've had 4 or 5 analysts that have gone to go visit clinics. They get to talk to data with their business partner. So facility and clinic level, or they'll go to our CMO council, huge council invites. And it's really because they develop that like sense of pride in their work, but also in their partnership. And so when, our care management has a good desk for analytics, and our, quality guys are deeply embedded with our clinical teams, that pride in like, let me bring my partner to the table, let me share that work. That's what kind of gets their presence out there, gets their foot in the door at a clinic. And then usually they're terrified, honestly, to do that originally because data guys, right? And but then they understand and they get to hear a nurse talk about how she uses a report every month and they're seeing improvement in patient outcome. And that resonates back to why we all choose to do healthcare, is to make that change and that positive outcome, right, in the health of others. And so that allows them to, I think, connect and feel refreshed about what they do too. Get over the scary part of doctors and nurses every now and then.
Yeah. And today, when it comes to the requests that you receive or what you choose to work on, how does that process work for you? Again, if you can revise that for us one more time, in terms of identifying and prioritizing what you and your team work on.
Yeah, so every pillar pretty much is led by a director and then a VP, and we connect an analyst right into that group. And so they receive kind of requests weekly, through email or chat or whatever it is. Our analyst tracks all of those. They go on the agenda under new work received for prioritization. And then they spend part of the agenda defining what that request is. It's that teach back. They translate it into their own words. Okay, I heard that you're asking for this. Clarify the need. And then they say, okay, where do we want that to fall? Because I've got these items that are almost done. Do I need to stop working on those? So it's that real-time dynamic prioritization weekly. If you get a big request, some of our requests will take 2 weeks or a month to actually stand up and get working. That kind of becomes like a time block. And they're like, okay, this is how many hours I spend per week on this product to get it done to hit your due date. So that means you have about, 20 hours of my time this week to continue with new work. What would you like me to work on first?
I'm curious also, there's some questions about how has the pandemic impacted the work that your team does and the priorities that you work on. I assume that there's so much change going on right now in the system that you have to react to that. Curious about what the impact has been on your end.
We've been super successful. We all went virtual. We all work from home. And our embedded partnerships, honestly, with our business partners, made us and kept us successful. And people understood that priorities were going to change. Strategies literally changed like every other day for a while. And they knew work was going to stop, work was going to start. And our business partners, they know that they can change prioritization any point in time. And so we literally had that, like, if you're, a lean mentality, it was like, stop the presses, stop the line, changing what we do, here's what we need to go do. And we have those shared, really that library, a really robust library of tips and tricks and technical stuff. It allowed folks that had never looked at inventory or a quality metric in their life or a utilization, RVU, any of that, to be able to get up to speed really quickly without taking another analyst's time to learn that. So that was super helpful.
Very good. And one final question is, where do you see as a natural evolution of what your team does? And what do you see, think next 12 months or so, what do you see as an evolution for the work that you do?
Yeah, we're going to continue down this path of machine learning and modeling. We are testing out a couple of programs that have been just recently launched, and we continue to connect and provide insights. And so then we just iterate back and improve our models, improve our processes, all of that, so that we can become more lean and mean around that, and also identify what data elements, what pieces we were missing the first go round that would have either helped educate or help drive improvement faster.
Outstanding, Maggie. Thank you so much on behalf of our global audience. Thank you so much for taking the time to share your experience and insights, all the great work that you and your team has done, and very grateful for you taking the time to do that for us.
Thank you. I appreciate it. Everyone, have a good rest of your day.
Thank you. Ladies and gentlemen, this concludes day 2 of BTOES Healthcare Live. So a couple of announcements, quick announcements and follow-ups. Lots of questions were asked today that I couldn't get to, unfortunately, because of the time that we have. You can still go under LinkedIn and look at my profile. There's a posting for BTOES Healthcare Live. Add your comments there, add your questions in there. we have several of our presenters who will drop in and will answer questions. I will do some myself based on the feedback that I get from the presenters. So feel free to use that if you still want to have answers to some of your questions. Also for tomorrow, let's take a look at what we have in store for tomorrow. In the very first session tomorrow, I will be leading a session on healthcare disruption and how great people and organizations innovate in times of uncertainty and rapid change, which is what we're going through right now, specifically in healthcare. So I will do a benchmark of great enduring organizations and how do they react to crisis. I'll go back to the 2008 financial crisis and some other crises, and how organizations that accelerate excellence and innovation during times of great uncertainty and disruption, they take on very beneficial competitive advantages on the outcome if you look 5-10 years down the line. So we're going to examine that. I think it should be an interesting journey to go with together. After that, we're going to have Dan Weaver from Gateway Health, and he's a vice president of Medicare and Medicaid quality programs at Gateway Health. And then Daniel is going to be talking about transforming the quality rating system paradigm. Very interesting review about how things are done and some of his new perspectives on how quality rating systems should be addressed in healthcare. We have Mohammed Hamani after that, and he's a senior vice president for transformation at Trinity Health. And Mohammed is going to talk to us about community wellness in the midst of a pandemic and how to address the social risk factors on a community level from a healthcare perspective. So very interesting, very broad view of and social view of what's going on right now, and how healthcare leadership and organizations play a significant role in the unveiling of this pandemic that we are going through. And we're going to wrap up the day tomorrow with a director from the Mayo Clinic, Eric Hannikin. And Eric is going to talk to us from the Mayo Clinic perspective, the impact of COVID-19 on global healthcare supply chains. I think everybody's very aware in this audience about the severe disruptions that we have had, possible dislocations that we have had in healthcare supply chains. So this is something that the Mayo Clinic has been studying for some time before the pandemic, with several experiences in different regions of the world with supply chain disruptions. And they're going to share their learnings with us. They're going to share kind of a path forward on related to supply chain in healthcare. So as you can tell, a very good variety of topics related to healthcare transformation, improvement, and innovation that will continue tomorrow. Again, very honored to be your host. Look forward to seeing you again tomorrow for our final day, and I hope that everyone has a great rest of their day. Thank you, everyone.